Hi everyone, and welcome to this tutorial on advanced medication and syringe handling for kitten fosters and people without medical training in the animal welfare industry. We're going to cover how to draw up medications from bottles, how to draw up thick solutions, and how to draw up medications that are dispensed in 3cc syringes. Definitely check out our other video on giving sub-Q fluids and how to safely handle sharps. We'll start off with drawing up medications from bottles. If required, shake the bottle vigorously to distribute the medication. At the start of kitten season, your medications will have completely settled and you'll be able to see a thick layer of medication at the bottom. No joke, you might have to shake them for 10 to 15 minutes until you can see all of the medicine dissolved. Hold the bottle in your non-dominant hand and invert it so that gravity moves all of the liquid to the bottom. Using your dominant hand, insert the needle into the center of the rubber port at the top of your medication bottle. You'll have more precision and the needle will be easier to control if you brace it on the fleshy palm of your hand. Draw up more medication than you plan on using. This is because there will be air bubbles in your medication and you're going to want to flick them out to get your final amount. If you just draw up a small amount, it's very hard to draw up only medication and no air bubbles. By having extra air in the syringe, you actually allow the air bubbles to coalesce and be more easily flicked out of the syringe. Once all your air bubbles are at the top, depress the plunger to get the correct amount of medication. If there's a very small amount of medication in the bottle, if you insert the needle all the way into the plunger, you might actually have the needle sticking out into air and you won't be able to draw up medication. Pull out the needle slightly until it's actually in the liquid. You might have to angle your needle to the side or hold the bottle at an angle in order to get the last little drop of medication. When drawing up a very thick solution like penicillin, if you're using a small needle, it can be extremely hard to pull against the vacuum that's inside the bottle. Another problem with using a small needle to draw up penicillin is that it can become clogged with medication. Number one, make sure you shake that bottle real well first. Number two, it's probably trapped at the very tip of your needle. So what you're going to want to do is to inject medication back into the bottle to clear your needle and then draw up the rest of the medication. Sometimes medications will be dispensed in larger syringes. That's because we don't want to give you the whole bottle since you don't need it, but this poses a couple of issues. Number one, it's hard to shake a syringe if it starts to congeal the medication, so just gently invert it back and forth until the medication appears to be dissolved. Your 3cc syringe has a lot of surface tension, so that means that if you turn it upside down without the needle on, all of that medication will actually stay in the syringe. In order to draw up medication, take the needle off of the lure lock and then insert your needle into the exposed part of the syringe. This can be a little bit tricky since it is a small hole, so be safe and don't stab yourself. Again, the technician is having issues with the medication clogging the tip of her very, very small needle, so she's trying to re-inject multiple times, but is failing. So it's actually not the needle that's the problem, it's the tension and the vacuum inside. So we're going to draw back slightly and put air in the syringe, and that affects the fluid dynamics, allowing her to draw up the medication. So now we're going to draw up some fluids as we would normally using a large syringe. With fluids, there's usually not a huge amount of vacuum, but it does take some hand strength to pull all those fluids in. Once again, draw up more fluid than you think you need, flick the syringe to make the air bubbles coalesce at the top. Notice how there is a sloped surface at the top of her syringe, and by making her syringe go totally perpendicular, she moves the air bubble into the hub of the needle and allows it for easy injection. When treating kittens with fluids and multiple medications, we recommend combining the medications together in the fluid syringe for easier administration. This is particularly pertinent for panleukopenia kittens, which you're going to be medicating multiple times a day. I like to keep my medications for panleukopenia kittens in a plastic container that I can easily move around and store in the fridge, and can easily disinfect the outside even if the contents, the medications, are contaminated. Make sure that there is some air in your fluid syringe so there's room for the volume of the medications. Depress the plunger and inject the medications into your fluid syringe one at a time. If your kittens all have the same dose, you can inject all of their medications into one syringe and then give them a small amount. For example, if all the kittens have the same dose and they all need 20 ml of fluids, you could use a 60 ml syringe, combine all the medications, and give 20 ml to each kitten. If the kittens have significantly different doses, then you're going to need to make a separate fluid syringe with medication for each kitten. After you've created your fluid cocktail full of medication, you're going to attach your butterfly needle and inject it in the kitten per usual. If you're dealing with kittens that only need 1 or 2 medications, You can inject them into their sub-Q fluids using their butterfly syringe using this technique. At the end of fluid administration, when the kitten has a bubble and still has the needle inside, unscrew your medication syringe, unscrew the fluid syringe, and attach your medication syringe. Insert the medication and then reattach the fluid syringe and flush it through with a little bit of fluid. Make sure that you leave some fluids in your fluid syringe, otherwise this technique will not work. This is great for kittens that need Syringe because you want to give the Syringe last since it stings, rather than mixing it in all of the fluids and making all of the fluids sting. However, this technique will only work if you got a bit of dexterity and a kitten that's not moving around too much. I hope you guys found these techniques helpful, and I look forward to seeing you guys as part of our medical team.